Welcome back to Talk to Doc. I'm Dr. Oyi Balburias with Miss Chiki Roa Puno, of course. Joining us now is Dr. Michael Sarte, the head of the Medical City Center for Snoring and Sleep
Disorders.
Center for Snoring and
Sleep disorders.
Yes. Of the Medical City. Yeah, habay.
Ang namin yung kailangan alagaan.
Yes.
We're talking about sleep.
Yes.
You know?
Yes.
Everybody knows naman we need sleep, Doc, diba? To recharge, to energize. Pero meron pa ba ibang importance ang sleep, and why do we have to get enough sleep every night?
Yeah, it's very important because as we spend our energy during the day, we have to replenish that in the evening. The problem arises if you lack that, you're not well enough or fit enough to work the following day. So it starts from there.
Right. Everybody talks about the magic number, 8 hours. Is that correct?
It's a good number if you can have it, but based on studies, 6-7 hours is good enough. But we're talking quality sleep. It's not just the duration, but quality is equally important.
So in the case of your patient, the one that we saw a while ago, Miss Joyce, what was the quality of her sleep before the treatment, before the RF turbinoplasty?
Yeah, it was not very good. In fact, she presented with symptoms of ultimately not being able to get good sleep. And it showed during the day. She was having some headaches. She was feeling dizzy. And she was weak. Even during the daytime, she presented with difficulty breathing. Plus, she was having palpitations, and her blood pressure was also going up. She's very nervous.
Meaning her symptoms actually is not just limited during her sleep, but mainly during waking time.
That's right. Actually, it presented during the daytime. It was affecting her
quality of life.
Quality of life.
Threatening, no? Actually, it is pretty dangerous, no? You talk about it as ultimately or potentially a life-threatening disease.
Yeah, especially if every night that's what happens, and you build up what we call a sleep debt, and it presents with worse and worse symptoms during the day.
Kasi ang gusto ko rin malaman, Doc, is alam ba nila pag nagigising sila, it's because hindi sila humihinga, so nagising sila because of that, or usually, I mean, nagkataon na lang na they get up?
Actually, Chiki, that's the problem. They don't know.
Yeah.
They don't know what
basically, it's the companion who mentions it.
Exactly, who notices it, and then when they wake up, they're not unaware that it can have bad complications. No? The problem is when it happens more frequently, and it gets to a time when you wake up and you really have a difficult time breathing. That's when you probably can rush yourself to an emergency
So there are things that actually should tell you that you have sleep apnea.
It starts
what else should we look out for? What are the things that would tell us that we have sleep apnea?
In the evening, it's really the bed partner who will notice. And the hallmark of sleep apnea is noisy breathing or snoring, actually. So it doesn't happen overnight. It happens with time, and it gets worse. So noisy breathing or snoring is number one. After that, what you just talked about, you awaken up and your bed partner sees that. You awaken, you gasp, you feel like you're choking, and it happens every night. So madalas, no? It's not just a regular snore, because someone can ask, it's just snoring anyway. No, but it happens every night. Even your bed partner has problems sleeping.
What would prompt a person to think that he or she has sleep apnea?
Aside from
in your practice,
not something else.
Actually, what a lot of us don't realize is that it is a not to mention one of the most common causes of hypertension. So your blood pressure goes up. Imagine sleeping in the evening, in the very shallow stages of sleep, getting lesser oxygen, your carbon dioxide level goes up, and that will equate with hypertension, with almost weeks or even months of having poor quality sleep. So hypertension is one, and because of poor quality sleep, daytime sleepiness. You are sleepy while driving, you are sleepy while at work, and these are just two instances when it can prove to be a problem, hopefully not fatal. You're driving and you're sleepy, you can get into an accident. If you're at work and you're in the middle of a transaction and you fall asleep or you're feeling sleepy, you might forget the numbers that you're talking about, and that can be a problem.
The interesting thing, and this is something that I hear in connection with this, there's such a thing called the sleep test.
Yes, which is very important for us to know which of among the many sleep disorders you have.
That's
no?
right. That's
Okay.
right. The sleep test is the gold standard, no?
Okay.
Because the best way to find out if somebody has a sleep disorder, notably sleep apnea, is by undergoing this test. The test itself is quite comprehensive, but in terms of hours, you just have to stay in the lab for about probably less than 10 hours
So it
maybe.
has to be in a contained environment,
It has to
in a
be.
lab. Hindi
Yeah.
pwedeng
Sure.
matulog ka sa bahay mo and then you observe certain things.
Yeah, it's in a controlled setup
Yeah.
because we have to evaluate your brain waves, your breathing patterns.
So what does it look like in your sleep lab? The kama siguro, comfortable, I'm
Yeah,
sure.
it looks
because
like a hotel.
Like a hotel
It
room.
looks like a
Really?
hotel, yeah.
Wow.
It has to be comfortable.
Oo. And then how do you doctors observe the patient?
There's a camera.
Okay.
And the computer analyzes the brain waves down to the breathing pattern, chest expansion, and we compare it to a normal. And we know what should come out if you're sleeping very well.
Okay.
If you're not, then you will see that you stop breathing, your oxygen level goes down. Worst case scenario, you can have what we call seizure activity, brainwave changes.
Okay.
And definitely your heart can beat a lot faster. And likening it to my patient who was experiencing even palpitations during the daytime, this can even manifest while you're asleep. And definitely, it's something that you can see in a sleep study.
Once you've identified among the many sleep disordered breathing, the many types,
Yeah.
so what happens next? Like you tell the patient, you either confirm to him or her that you have this, then what are the treatment options?
The first is to find out which, if positive, if the patient has sleep apnea, we
Okay.
find out which area is involved. And there are two main areas, in the nose and in the throat.
Okay.
Once we know which area seems to be obstructed, we address that. On one end, there's a medical. On the other end, there's surgery.
Okay.
The medical, as it is more conservative, we deal initially on the basic lifestyle modifications. Weight loss, staying away from alcohol.
Wow, may kinalaman lahat
Oh
yan,
yeah,
ah.
Lifestyle related
Staying away
again.
from cigarettes,
Yeah.
having a dinner that's not too heavy, sleeping in a good, not too late,
Okay.
and ultimately we have what we call ventilation therapy called CPAP, or continuous positive airway pressure.
Which is this one.
Yeah,
This
exactly.
thing.
It's an accepted treatment, in fact. For sleep apnea, because it pushes in air while you're asleep. And although it may look a little different, no, when you're sleeping, if you're really sleep deprived, and it gives you good sleep, you won't think that it's there anymore until you can get good sleep. So that's on one end. On the other end, surgery, you can do
Surgery.
procedures for the nose, like
Wow.
what we did with Joyce, no, radiofrequency turbinoplasty, which is an office procedure. And if that is the problem, that's going to solve everything. No? On the other is if you have large tonsils, you can remove the tonsils as well. But these are procedures done, that's a procedure done in the operating room. So those are the procedures that can be done. Whatever technology you acquire, though, the main purpose is to open up the airway so that oxygen can flow.
I'm thinking other sleep disorders. I'm sure you can take something orally
Yes.
for these other things.
Oh, yeah.
Probably not apnea.
No,
Pwede.
definitely not. Insomnia. It's
Insomnia.
a very common. You know, we're talking about insomnia, sleep apnea, the top two.
Okay.
And for insomnia, definitely there is a role of pharmacology. You give medications to help patients sleep
Yeah.
better, but it's not as simple as that. The problem with just giving medications is that you can have a relapse very quickly. So you have to combine that with counseling also. You have
So
to
with the
find
right
out.
medication, you have to ask your doctor rather than self-prescribe, right?
Exactly,
Yeah.
exactly. There are a
Many-
lot of
Ang dami
complications.
nga. Akala mo
Many
kasi, di ba? You think it's not a very serious thing, but
Yes.
I think it's a good time to remind people, that, especially for sleep disorders, you
Yeah.
really need to consult.
Yes, yes. The solution is not to pop the pill right away.
Yeah.
Yes.
You have to find out. You know, it's as simple as telling you, hey, you have to just change this in your lifestyle and you'll sleep better.
Yeah.
And you
Weight
don't
loss
have.
lang pala kailangan ko minsan, you know?
That's true. That's true.
Removing the television from the room.
Yeah,
is already-
that's true. That's
I
true.
mean,
That's
many
part of the
patients,
guidelines.
yeah.
Yeah. Not putting your
Putting your
laptop in
laptop.
bed.
Yeah. For
That's
all
it.
to the-
Exactly.
Yes, yes.
That's part of it.
There's so many more to discuss about this topic, and I'm sure our studio audience also has a lot of questions about sleep disorders. So we'll just pause for a break. Talk to Doc will be right back.